the mitochondria are not working very well. They've been damaged some way. They're not delivering their energy very well. So methylene blue is a good wake up call, so to speak, for the mitochondria to say, hey, wake up mitochondria. Let's start working again. I'm Dr. Jake Schmitz. I'm an integrative doctor. And on this channel, I share with you how you can heal your body down to the root causes without any harmful drugs or surgeries. Make sure to subscribe for more videos like this one. What is methylene blue and how is it conventionally used? So methylene blue is a drug that was developed a long time ago in the late 1800s. And it was first used for like absolute treating medical conditions. Back in 1892, it was used for treating malaria. Right now, it's not used as a common malaria treatment, but it's used for a condition called methylhemoglobinemia, which is a condition that the hemoglobin inside the red blood cell is not delivering oxygen efficiently. And you're going to die if you don't get that fixed. The methylene blue is our best treatment to treat that. So this is used a lot in the emergency room. And really most doctors that know about methylene blue, they're mostly ER doctors. I don't think a lot of other doctors know a lot about methylene blue because it's not a common treatment that they use. So that's the methylene blue in a nutshell in the conventional side. Why is methylene blue getting popular these days? And we can blame this all on the COVID pandemic. That's what really got the research going. That's what got doctors using methylene blue. And that's why we're using it a lot in medicine nowadays. Now, in my integrative medical approach, methylene blue has been used well before COVID, but that's really when the research started blowing up and researchers trying to find things that can help these people deal with post-COVID syndrome. And methylene blue was one that was identified. It is a strong mitochondrial stimulant. So, like I said, in the conventional medicine, it's used for microhemoglobinemia because it stimulates complex 4 and stimulates the hemoglobin to be able to deliver its oxygen better. But that works in every cell. It's not just the red blood cell. It works in every tiny little cell we have, the heart cell, the brain cells, muscle cells, all that is all dependent on methylene blue. So like in post-COVID syndrome or many other chronic disease syndromes, or like in chronic fatigue syndrome, the mitochondria are not working very well. They've been damaged some way. They're not delivering their energy very well. They're not going through the processes appropriately to make ATP that is used for energy. So methylene blue is a good wake up call, so to speak, for the mitochondria to say, hey, wake up mitochondria. Let's start working again. And it works directly on that complex 4 of the electron transport chain. So as you can imagine, since it does help the mitochondria, it can help with so many different medical conditions. And I'm using it a lot more in my office for people that do have these mitochondrial traumas. It is extremely common that people have mitochondrial issues, like I said, in chronic fatigue syndrome or fibromyalgia. Big piece behind the chronic pain that happens with fibromyalgia in the muscles is from degeneration of the mitochondria not working appropriately. So methylene blue can work for that. Also, chronic fatigue is related to that too, because you're not making good energy, right? ATP. So you're going to feel tired all the time, feel lethargic, brain foggy. So it works really great for those conditions. But also, if you get exposed to chronic infections that can lead to these conditions I just talked about, chronic fatigue, fibromyalgia, also could lead to autoimmune disease like rheumatoid arthritis, Graves' disease, Hashimoto's thyroiditis, whatever, all kinds of different autoimmune conditions. The infections cause damage to the mitochondria too. Epstein-Barr virus, cytomegalovirus, chronic Lyme, etc. They all damage the mitochondria. And that's why so many people experience so many symptoms when they do have Epstein-Barr virus or some other chronic infection because of damage to the mitochondria. So methylene blue is a really great treatment we do when I'm treating people with autoimmune diseases or chronic infections because it stimulates that mitochondrial function. And it's a very cheap, highly effective therapy that we can do that has very little to no side effects with it. That's how we use it in the functional medicine space. Something also I wanted to really dive into is I love this for neurological disease. So Parkinson's disease, ADD, ADHD, Alzheimer's disease. So I talked about how it's great for the mitochondria. 70% of our mitochondria is in the brain, in the central nervous system and the peripheral nervous system. So I use methylene blue to help these specific conditions. But what I do to elevate the effect of methylene blue, and I do this with a lot of substances, but a big one is methylene blue, is I photosensitize it. We can really elevate the effect of methylene blue in a certain region of the body. More specifically, I'm talking about the brain, right? So we can photosensitize the methylene blue in the brain. So we take it about an hour before we do like a near infrared light cap. that methylene blue's in the brain, and then we can photosensitize it, make it even work better. And we're able to heal the brain and make the brain work better. So this helps with the Parkinson's, Alzheimer's, works great for ADD, ADHD, because it really elevates the effect that methylene blue already has, but it makes it a much more powerful substance at that point. And then we could also put someone in a red near for red light bed after taking methylene blue, and we could get those cells working even better than they ever worked before with the combination of methylene blue and the red near infrared light. With red near infrared light's already great on working on the complexes electron transport chain, but if we add methylene blue with it and we photosensitize the methylene blue, man, we really get those cells really churning and really heal the cells really well. And it could be a full body systemic treatment. And I'm really having great success using the combination of methylene blue with photosensitization with the red light. So how long do I treat the average patient with methylene blue? This all depends on the patient and how severe the patient's condition is. It's hard to say. I mean, some patients, if they're coming in, they just barely got exposed to, let's say, a certain infection, let's say mono, for example. This got acute exposure, but they're still feeling like they're really dragging and they're really tired and not functioning optimally. They would only need it for a month. But let's say someone has a chronic autoimmune condition, they've been dealing with it for 5 or 10 years. We're going to do this for probably at least 6 months, up to probably 18 months to a year of really getting those cells healed up. Someone with like Parkinson's disease, we're going to do it for at least a year also. So when someone has this chronic degenerative disease, we're doing it for at least 6 months or longer. So is there acute treatment and ongoing maintenance treatment? Yes, for sure. And I've figured this out just with practice, right? We call it practice because really doctors are always learning with their patients. Is I would get people feeling really great, and they're in the acute realm. Yeah, we get them feeling great and they can continue to feel great. But with chronic disease, I get them feeling great. They're doing good. I'm like, okay, let's stop you off stuff and see how you do. Let's stop the supplements. Let's stop the procedures we're doing to see how you do. And many of my patients start to regress and not get where they were. They come back into my office like, hey, I'm not doing as good as I was. I'm doing better, but not quite as good. So I've learned that we need to do maintenance protocols and we need to do touch-up treatments. So yeah, methylene blue is like, okay, we do it for 6 months and then we stop it for a bit, but we're going to have to do it again, maybe in 3 or 4 months after that to give the cells a restart for like 2 or 3 months again. We might need to do the red near infrared light bed or the red near infrared light cap and get things churned up again. And if someone's really sick, let's say someone has Parkinson's disease or Alzheimer's disease or autoimmune disease, many times we might have to keep them on an ongoing maintenance protocol to keep them feeling good. So what does a patient go through when they're getting a treatment with methylene blue? So I'm giving them methylene blue daily, 1 or 2 times daily. I'm giving about 15 milligrams, depending on the medical condition. And then what I'm doing now, more advanced therapy, is I'm photosensitizing it with light therapy. And so daily methylene blue, and then we're doing red light therapy 2 to 3 times a week. And we're doing that for about 2 to 3 months. And then depending on how people are doing, we might be doing a maintenance protocol of doing red near infrared light like once a week or every 2 weeks to keep the results that we've gotten. How do I administer methylene blue? Now you can do it orally, like a pill or a liquid, or you could do it IV. So methylene blue is highly absorbable. I did do methylene blue IV for a little bit, but it's really expensive and it was costing patients a lot of money. They weren't able to get long-term therapy because it was expensive. So I've moved more to oral and it absorbs just as well oral as IV. It's just much faster IV absorption than oral. So that's why I'm saying, so what I do is I have someone take a capsule of methylene blue and they come in our office an hour later and we do the red light therapy an hour later or an hour and a half later because that's when it hits its peak of absorption. And then we're able to have those good therapeutic effects that we're talking about. Now, if you do IV, you could have the red light cap going at the same exact time as you're doing IV, and you're going to get that continuous hit. So that's good in that way. And then also you could do the red light bed right after doing that. So that's beneficial too, but a lot more expensive and not really that much more effective doing an IV way. Yeah, let's talk about some of the side effects that could come along with methylene blue. So you need to be aware that it is going to make your pee blue. So you might think that you're an alien or something, but it will make your pee blue. So it's very interesting, or green. So be aware when you're doing that, it will make you make your urine a different color. Also, if you're doing a liquid methylene blue or a chewable methylene blue, it can make your teeth blue. So you need to be aware of that. Some ways to inhibit that is you take the methylene blue, let's say you're doing a liquid, is you eat right after, and that usually clears it up. And then you brush your teeth right after, and then that doesn't cause a problem. It stains like crazy. So don't spill it. Don't pour it on your couch or anything, or even on your white countertop, because it does stain readily. But those are really the only side effects that come along with it. Except one thing that I have to mention is probably people listening to this are going to be like, oh, I'm going to do methylene blue now. They're going to find it on a website. You got to get methylene blue as pharmaceutical grade, meaning it comes from the USP Pharmacopoeia. Okay. You do not just get a random methylene blue from the internet and take it, because it can be poisonous. You do use methylene like in fish tanks. Some people that have fish tanks might be familiar with methylene blue. It helps clean the system or whatever. So don't get it off the internet. Go to a doctor that knows what they're doing, or get a prescription of it, or get a supplement that actually is pharmaceutical grade. I recommend really getting it from a doctor that knows what they're talking about. Also, methylene blue can be very high in certain heavy metals and all that, because it's not supposed to be used for internal use, even though they are having them sold on the internet. They don't really say you're not supposed to take them internally, but they're not supposed to be taken internally. So just random methylene blue off the internet is a very bad news and can make you sick. So make sure you get it from the appropriate source. Yeah. So if you're interested in methylene blue or other treatments for me, visit my website, integrativemedica.com. Find my phone number there. Give my receptionist a call and you can set up an appointment with me. We could do in person. Also, we could do virtual visits. If you want to, you could directly set up an appointment through our website. If you want to learn more about integrative approaches like methylene blue, glutathione, and more, click my videos to the right. I'm Dr. Jake, and I'll see you there.